Well, thank you, Peter, for the invitation to be here. It's really an honor to be here. It's an honor for me to work for the World Health Organization and represent surgical care, anesthesia, part of obstetrics. My background is neurosurgery, and I even include neurosurgery as part of global surgery. So this is from the Lancet Commission. We know the need. Lars spoke eloquently about the global need. 5 billion people that don't have access to safe, timely, and affordable surgery. The other part that's left out is the tremendous need for money to push this forward. If you look at, is this a pointer? This little guy down here, HIV, AIDS, TB, and malaria accounts for about 3 million deaths per year. And those are not trivial deaths. A death from a surgical disease or HIV is the same. But this little guy down here, they have annual budget of $5 billion US. Cardiovascular deaths, many of which are preventable, are about 17, 18 million deaths per year. The total surgically avertible deaths per year are about 17 million. And we have no global fund. We have no global donation, if you will, or prospects for money to drive these things forward. And it takes money to make things happen generally. Part of what was the four things that happened in 2015 were the DCP3 that Lars spoke about, the Lancet Commission that he spoke about, and the resolution that was passed. Well, you think in terms of United Nations resolutions and WHO resolutions, that's really a good thing that every country on the planet voted that strengthening surgical care and anesthesia is part of universal health care. That's a great thing. The part that's left out is that only about 20% of WHO resolutions actually come to fruition. There's a lot of resolutions passed every year, and most of them end up in the trash bin. The fourth thing that happened in 2015 was a change from the Millennial Development Goals to the Sustainable Development Goals. And why is that important to surgery? Well, the Millennium Development Goals had 3 that are relatively associated with surgery, but this has 8. I've highlighted also in blue circles the one related to pediatric surgery, but there's 8 related to surgical care. And if you look at the Sustainable Development Goals, there's a number. I've put a red square around the ones that are all pertaining to surgical care or anesthesia. And most importantly, number 17 is developing partnerships to drive the fulfillment of the Sustainable Development Goals. So I want to talk about partnerships, because none of this happens without us working together in some manner. If you can imagine one guy, and I'm the only one at WHO working on surgical care. There's one other working in surgical oncology. But basically, all this essential surgical care and emergency surgical care is dumped on my desk. And it is easy to see that one person sitting in Geneva can't change the world on surgical care. It's going to be all of us paddling the canoe together, pulling the plow in the same direction, whatever metaphor you want to use. It's all of us working together. Internally, I have a lot of partners, and I won't go through each one of them, but the strong partners are NCDs and cancer and violence and injury and disasters. Maternal care, but there's almost no program at WHO that I don't have some reference to, whether it's lymphatic filariasis or HIV or whatever. We work with almost everyone. Externally, that we have a lot of partners too. We have WHO collaborative centers that are specifically targeting surgical care and anesthesia. One is Lars at Lund University, looking specifically at at the surgical workforce. But right now we have 5 collaborative centers for surgical and anesthesia things. And then we have groups that have what's called official working relations with WHO. Sorry, I'm getting over a cold. There are several, the World Federation of Neurosurgery Societies, my tribe, World Federation of Societies of Anesthesia, International Surgical College, et cetera. Member states, and then there's others, ICRC, the Red Cross, MSF, academic circles, and other NGOs. These are our external partners. And then if you want to think of my program or our program at WHO in terms of the essential things, these are the pillars of my program that really are the outstanding things that I'm really working on. One is these external collaborative centers and people with official relations. Those are big partners. Children's surgery, which I'll talk about in a minute, it's a big concern of mine because it's such a huge, vulnerable population. Global surgery, neurosurgery, orthopedics, cardiac surgery in the sense of not bypasses for everyone, but in this rheumatic heart disease. There's like hundreds of thousands of people that need surgery because of rheumatic heart disease, and urology for a number of reasons, obstetrics, anesthesia, and then national surgical plans, which I'll talk about in a second. So these are some of the current priorities, and I'd just like to talk about them, but bear in mind that I'm bringing these up not because they're so important, but because of the need for strong partnerships to accomplish any of these things. So at the last World Health Assembly in 2017, we had an official side event which we talked about how much we've done to implement our resolution that was in 2015. One of the requirements of the resolution was report back to the WHA 2 years long, which was last year. At our official side event, the government of Zambia presented their national surgical obstetric and anesthesia plan that was completely costed, completely embedded into their national health strategic plan for the next several years. And as soon as this was put out, we distributed it to everyone that came. As soon as that official side event was over, there was lines of people wanting to talk to John Mira and I about, we want to do that too. Can you help us do this? First was Zimbabwe. Like, we're next door to them. They're our brothers. We speak the same languages. And can you help us in Botswana and Namibia? And there was a whole line of people. So there were so many that John and I decided, well, we need to not go country to country, but we need workshops to teach whole regions how to develop national surgical plans. So we're having our first one the week after next in Dubai. And this is just a kind of a description of it. We were hoping just to have a few countries show up and we could show them in this workshop how to do it. It ends up that there's 23 member states, countries, that want to come to this workshop to learn how to do it. We're preparing a manual so that it'll be published, it will be available online. This is how you do it from A to Z. And we've already been invited to develop a Francophone one for West Africa, as well as another workshop that will be held in Southeast Asia sometime in the future. There's an absolutely huge demand for this. If you look at the public health trends over the next 15 years, we're winning the war on communicable disease, but we haven't touched the non-communicable diseases. Just looking at cancer, for example, or as a neurosurgeon, I'm also interested in stroke. We haven't touched strokes. Strokes in the developed world have gone down about 42% the last couple of decades, and they've gone up about 4 times in the developing world. Same with cancer. If you look at cancer, our risks in the developing world are pretty high, much lower in Africa, but it's higher than the incidence of HIV, and these rates are rapidly coming up to what the ones in our countries are. The number 2 cause of death globally, 70% of diagnosed cancer in Africa ends up as a mortality figure, 70%. And why is surgery important? Well, if you look at the need and the impact and the cost, surgery is relatively low cost compared to the radiation and chemotherapy. And if you have a diagnosed solid tumor in sub-Saharan Africa, your chance of overall survival are nil without surgical care. Surgical care is about the only way you're going to be healed. If you look at injuries, this is from DCP3. If you look at the avertable deaths per year, 68% of them are from injury. Burns, I had to give a talk on burns. Neurosurgeons don't know much about burns, but I was invited to speak about burns, and I learned a great deal. 30,000 new burns around the world every day, 30,000, many of them in children. Speaking of burns, I had to throw this in. In 1987, WHO published this, The Effects of Nuclear War, with a resolution. And the resolution calls for the Director General to send this to the Secretary General of the United Nations, et cetera, and to report periodically to the World Health Assembly on progress in this field. This was the very last thing ever said about nuclear war at WHO. And for some reason, I started thinking about it this year. Traumatic brain injury, it's number 1 lethal injury every country of the world. And so we have a number of things going on to treat head injury. So children, if you look at this from the World Bank, on average in the world, 26% of the world is under the age of 15. If you look at sub-Saharan Africa, it's 43%. That's average. Niger and many other countries, 50%. And these are all vulnerable populations. Why? Because the adult surgeons, we talk about the need for surgical care, but if you look at the surgical care for children, it's much, much worse. Nobody wants to operate on these kids. The risks are much higher. We're very careful in blood loss in a newborn, for example. The pathologies are very different than the adult surgeons have seen before. They don't want to touch these kids. And guess what? Kids don't have much money, and surgeons like to get paid. And in democracies, kids don't vote. So it's a very, very large, very vulnerable population. So we're working with the Global Initiative for Children's Surgery, coming up with optimal resource guides for hospitals if they want to treat children. They just came up with their own surgical assessment tool for pediatrics. So collaborative centers, we have, the WHO has divided the world into 6 regions. And my goal is to have at least one collaborative center in each of the 6 regions. Some are easier than others to have collaborative centers in. But each one has a specific niche. Mongolia has one on distance learning. University of Western Ontario in Canada is all about anesthesia and perioperative mortality and morbidity. Lund on surgical workforce. Mumbai on surgical care delivery in remote areas of India. And since just the nature of the hospital, we're also working with them on issues with surgical cancer care in remote areas. The Harvard group on developing national surgical plans, they're very strong partners with us. And in fact, I have a Harvard fellow with me. They change every 2 months, but they're there seemingly permanently. Bogota on head injury, Zambia on information management in remote areas, and then Beijing on the surgical and endovascular treatment of stroke. So this is kind of our goal for collaborative centers, how we can all work together again. You can kind of see a theme on partnerships, I hope. Lastly, this is just a case study that I wanted to bring up. Some of you know this case, but it's not to be accusatory or pejorative, but just You know, when things don't go as I would like in the operating room, I usually pull people together afterwards. Okay, how can we do it better? What can we do as a systems to make it better so it doesn't happen again? So let's just go over this. Ministry of Health, WHO country office, and the regional office, UNFPA, Country Medical Association, a bunch of NGOs, all got together and felt the need for WHO to provide guidance on the process of implementing surgical task shifting. Sounds like a great deal for partners to all come together, do the right thing, and they wanted, of course, WHO financial and technical support. Well, that's the wrong bank to come to because we don't have any money, but anyway. But to start this process, let's all get together, let's have a symposium, let's talk about it. The country office was going to organize the meeting. The Ministry of Health was willing to host the meeting, and it all looked great. That was a year, 18 months ago. So what happened now? Well, it got stalled at the WHO country office because, number one, I didn't know about it, and I couldn't. Surgeons tend to get things done. And so when we started pulling all these partners together to make it happen, then guess what? The Minister of Health changed. And they haven't been confirmed by the Senate. We don't know what their agenda is. So it fell flat. So there's an expression, chance favors the prepared mind. Well, chance favors the surgical groups and partners that are ready for the next time this happens. And I want us to think of being ready when we get offered by countries saying, we would really like your help in helping us establish a national surgical plan, for example. We would like your help in developing task shifting for surgical care. Whatever it is, we need to be ready and we need to leap at the opportunity to make that happen. So possible next steps. The political case has been made for surgical care. The political case, the economic case from the World Bank has been certainly made. The needs case is overwhelming. The cases have been made, so now we just have to put our efforts together to bring things to fruition. There's a lot of work to do. We really need to strengthen our partnerships. And as I was telling the group beforehand, that the most sustainable and the best partnerships are ones that are associated person to person, face to face. It's not MOUs between institutions. Those fall flat if people leave. It's personal contact, getting to know people. As Woody Allen said, 75% of life is just showing up. It's being there, it's talking to people, and developing that relationship. And I had to throw this in too. Those of us as surgeons sometimes in conflict zones, my friends at MSF and ICRC, they say sometimes in conflict zones, the only people still talking to each other are the surgeons on both sides. Politicians have stopped, everybody stopped, but the surgeons are talking to each other. We need to use health as a vehicle for peace, particularly surgical care. Thank you very much.